I can truthfully say I've seen healthcare change radically. And what bothers me most is that I see all these young people coming into healthcare and not really having a chance to really see healthcare the way I used to see healthcare. And there's no time to really take care of patients anymore. There's no time to really sit down and do what you were trained to be doing.
I think this fight is of the utmost importance because in surgery as well as other areas, we do see a big turnover rate with our staff. And it's hard to, look at bringing in new staff and spending several months training them to do, a difficult job, and then watch them walk away and we're in the same position where we have to start all over again.
I've been at Research Medical Center for 7 years, going on 8 years, and in that time we have had a turnover of 7 different techs. So we're constantly retraining, constantly trying to get us back up to speed, and it shows. It shows throughout my whole department. With all the turnovers, you're always having to train, and plus the jobs are not filled quickly. The staff is overworked, they're underpaid, and right now in the lab we've lost 3 jobs, and next weekend I'm going to have to work the night shift and the day shift both.
So you're down because they haven't rehired person within that 30 days, then you have to make up for it and work a little bit faster.
My problem is I don't feel like I'm doing the care that I have done years ago because I'm getting too many patients and I can't attend that satisfaction that I would like to give them.
And one of the reasons we don't have adequate staff is because our benefit plan is inadequate, as well as our wages being some of the lowest in the city.
Right now, what matters to me is our health care. HCA says they, are committed to the care and improvement of human life. That should start with us as employees. We have had employees that could not afford to go to the doctor. It was costing them over a day's pay just to go to the doctor. As healthcare workers, we have to have them take care of us. We cannot take care of our patients unless we can take care of ourselves. Healthcare is very important to me as an employee.
I believe that the fight that what we're fighting for now is so very, very important. I have a family of 6, 2 children in college, and I am having to decrease the amount of insurance that I have to pay in order to put it in the flex spending so that I can take care of all the co-pays that I have to pay when I go to the doctor or the dentist or anything else.
This year I had to get a physical because it's required, and it cleaned me out of my savings.
This last year was the first year I've been benefited, and I paid out at least $8,000, if not more, dollars for my premiums, my co-pays, and for my labs and x-rays and medication. It's a shame, and I've heard it from many people that are not in healthcare, when I tell them what I have to pay, that they say over and over again, but you're a healthcare worker, and yet you can't get healthcare? It's embarrassing.
The whole time I've been working in research, I never had to make a decision of like, okay, I'm going to cut this out. I have to lower my insurance premium, in order to pay the rent and all that, and while the big guys' pockets are getting fuller and fuller.
Companies that invest in their people retain employees and have happier customers. Above all else, we, as employees and myself, want a fair market value wage.
To invest in us is to be investing in the patients as well.
I love my job. I love my patients. But the reason for this fight is I want to feel appreciated. I'm worth more. Thank you.